Welcome to Combined Grand Rounds. I'm Alan Quart, the Assistant Dean for Faculty Development, and this is one in our series of Combined Grand Rounds. I do want to remind everybody just some housekeeping issues. One is please make sure you keep your mics muted unless you're asking a question. For those of you who want CME for this, please sign into the chat so you can obtain CME credit. There will be a question and answer period at the end of Katelyn's presentation. And with that, I'm going to turn it over to Robert Zylstra, social worker at Family Medicine, to introduce our guest speaker. Bob, all yours.
Thank you, Alan. Good morning, everyone. It's my pleasure to introduce Katelyn Jeter. Ms. Jeter currently serves as Executive Director of Purpose Point Community Resource Center, as well as being the District 5 Commissioner for Hamilton County. She holds a degree in Human Service Management from the University of Tennessee here at Chattanooga, and has more than 20 years experience overseeing programs helping people understand and navigate community services and healthcare. Katelyn and I first got to know each other probably a decade or so ago now. As she was one of the original navigators for the Affordable Care Act, more commonly known as Obamacare. Katelyn is passionate about healthcare, education, and community development. Her goal is to not only increase understanding of community resources, but also contribute to those resources in an effort to reduce health and education inequities and disparities for minorities and communities throughout Tennessee. Please join me in welcoming Katelyn Jeter.
Thank you so much, Bob, and thank you to everyone that's here this morning. It truly is a delight and honor to be present with you this morning to talk about a subject matter that is near and dear to my heart, and I am so passionate about this, and I hope that it is displayed this morning as I talk about this subject matter, and I will be speaking from the topic of our lens for addressing health equity and why it matters. So let's get the PowerPoint up here. Can everyone see that?
Yes, I'm seeing it.
Okay, thank you. I was like, I hope somebody out there can let me know. So again, talking from the topic, our lens for addressing health equity and why it matters, specifically around social determinants of health. And before I get started, just really kind of want to emphasize some of the takeaways or the learning objectives that I hope you glean from this discussion that we'll have this morning. And there are just three basic ones for me that keep me fueled in this work around advancing health equity and around working with social determinants of health here in our city and our county. And that's one is advancing and improving health equity. Really, for me, it's about addressing the social determinants of health within our communities in terms of how we live, how we work, and how we play. And really understanding what social determinants of health are, what they are, and what they mean, and why do they matter, but more so than that, in terms of why they matter, how do they fit within our current public health systems? And then the last but not least, you can't talk about this work and not be compelled to do something about it. So truly a call to action at the end about what will it take for each of us in our respective roles, no matter what you play or what your profession is. What would be your approach or our approach to proactively work on the barriers and challenges that our patients and our clients experience to improve their individual health as at the same time our community health? So I was kind of asked to do this, and this, I'll be honest, to include a little bit about my background. It was the first time that I was asked to do this. But after giving it some thought, I thought it was actually a great idea because who I am as a person is not displayed up here on the screen at all. But what you're seeing definitely provides some context as to why, again, this work and this topic is near and dear to me and why I'm so passionate about it. So briefly, I always get asked, am I here? Have I, been born and raised here from the Chattanooga? And the answer is no. I was born in Colorado. I'm a military diva, not a military brat. There is a difference. Only child. Both my parents proudly served in the United States Air Force, but I was raised by my mother, a single parent. Most of my upbringing was in overseas in Europe, in Italy. We lived there for almost 9 years, my mother and I. But we moved here to Chattanooga. This was my mom's hometown, and we moved here when I was 11 years old. So Chattanooga has been home for a great amount of time of my adolescent and an adult life. I proudly attended Tyner Middle and Tyner High School and graduated from Tyner High. And as you can see on the right side, this is kind of my professional journey, and there's certainly a lot more there to that. But these are really the things when I think about why I do this work and what got me started in this work. This is kind of those items. I started out at Chat State. Believe it or not, people always say, why are you in healthcare, or what got you involved in healthcare? I actually started out wanting to be an NICU nurse. My oldest son was born premature. And so I thought my calling was to be a nurse. So I went down that path and then started out Chat State, taking all my classes for nursing school. And while waiting to get accepted, I started taking social work classes and fell in love with social work. Really got passionate about social services and how individuals in our communities, especially our most vulnerable, how do they engage and connect to services, not only on the health side, but more so on the social side, the things that they need from day in to day out. Got accepted into Cleveland State, but didn't stay there long. Had a professor that told me, Kathy, you were meant to serve, but not as a nurse. So went home, prayed about it, talked to my mom, and quickly went to UTC and attained my Bachelor's of Science degree in Human Service Management. In 2012, I was delightfully honored by the White House during President Obama's administration with the Champion of Change Award for the work that I was doing in the Affordable Care Act. So a lot of my years in working in the community has been more so around healthcare, but specifically health insurance. And so I have really engaged on the healthcare side in the system lens or system way, should I say it, when it comes to how patients or individuals in the community have to obtain services because of the lack of health insurance, or even because they have health insurance and they don't understand their benefit side. So through that work of 12, 13 years of doing that kind of work, that's really what got me more propelled into understanding the more complexities of the issues that people were living with, and that's those social determinants of health that we're going to speak of. And I think ultimately that has led me to be able to serve now as this executive director of Purpose Point Community Resource Center, which is the nonprofit arm to the Mount Canaan Baptist Church. We have two focuses. One is the health and wellness, which is our Purpose Point Community Health. We operate a faith-based charitable health clinic in the heart of East Chattanooga. And honored that this year we'll be opening Purpose Point Learning Academy, which is our early childhood side, which will be a high quality learning center for kids 0 to 5 years of age. And as Bob stated, I am proud to say that I am a Hamilton County Commissioner for District 5, and I have been serving as the District 5 Commissioner since 2008. The last two things on the screen as I move on, they're bolded for a reason, not to say that the rest of the things listed here don't make who I am as a person and that they're not significant. But when I was thinking about my journey and my background, I would probably say these last two things, my over 20 plus years of being able to be on the ground and work in the community has been the most inspiring and fulfilling work of my life. Every day I am blessed to wake up to do this work, but also to do it as a proud mom of two boys, Jack and Austin. these are the things that I get up and I get it, even though I'm exhausted at the end of my day, this is what gets me excited and keeps me going to continue working on reducing those health disparities and education disparities and inequalities that we see so much. So I'm a believer that before we can really kind of talk about solutions and, even define and have a better understanding of a topic, we've got to kind of, have a come to Jesus meeting, right? We've got to be real about the challenges and the issues and the problems that exist. If we don't acknowledge it, and if we don't call it out and we don't say it, and if we don't address it, then it's going to continue happening. So I wanted to briefly talk about what the problem is, what are the challenges that all of us are seeing, whether, again, you are working in a hospital system, or you have your own practice within the community, whatever the case, I guarantee you're seeing these issues, right? Health disparities challenge poor health as well as safety outcomes, which includes chronic diseases, mental illness, substance abuse, teen pregnancy, access to primary care, cancer, violence, and much more, right? And what we know is that these disparities disproportionately are higher among low-income individuals and people of color. Our systems, and oftentimes the policies more so within our systems, has and continue to have a profound impact on our vulnerable populations, which resultly increase their health risk factors for illness and injury, which include reduced access to fresh, nutritious food. The zip code that Purpose Point resides in, 37406, is a great example of that. That's a food desert, and we have many of them across our city, right? Fewer opportunities for physical activity. I can't tell you how many times as I continue to go throughout my district, District 5, but even other districts here in the city and county, that there's no sidewalks. So when we talk about why we have the prevalence of obesity in many of our zip codes and here in the state of Tennessee, one reason is because of the decrease in physical activity among individuals, but because a lot of the communities that our patients and individuals live in don't have safe communities. And secondly, they don't have sidewalks to even allow them to be physically active. And then greater exposure to environmental toxins. And then this is one that's really been a hot topic lately in our community, and that's substandard housing and the lack of affordable housing, which all really correlate and have a huge impact on a person's health. So as our presentation topic says, I'm going to ask the question, and you'll hear me throughout the presentation talk about this. What lens are we willing to use? Is it a health-only lens, or is it a system or policy-only lens, or is it a community-based lens that allows us to fully see the realities that that people are living within our communities? So let's take a moment and kind of just talk about, what does it mean in this work on advancing and improving health equity? Let's make no mistake, right? What we're seeing and what we're experiencing has been the results of years and years of policies and practices. And so this work is not going to be easy to change overnight. That's not what I'm going to spend these moments with you talking about and convincing you to come and wave a magic wand and change how we do this. That's not what this is about. But there is good news. I am here to share some hopefully lay some nuggets with you, but also leave some good news that change is possible and that we can begin integrating approaches within our practices, within our hospital systems, within our communities, and individually with the people that we care for and that we treat, to begin to start to see the changes that we want when it comes to how we advance health equity and really address the health disparities that we see. So I love this definition of health, right? It speaks to the importance of looking at health holistically, in that it's more than just the physical aspect. It is the complete state of the physical, the social, and the mental well-being, not one over the other or the absence of one. It's the combination, the complete of all three. The CDC defines the meaning of health equity as meaning that every person has an opportunity to achieve optimal health regardless of the color of their skin, their gender identity, the job they have, the level of education, the neighborhood, the zip code they live in, as well as their sexual orientation. So again, I asked each of us to think about what lens are we willing to use. So as we were waiting for individuals to kind of start coming in, I was sharing that I'm a person that loves affirmations and quotes and that words matter. And I was hesitant to put this one up here this morning with you, but as I was getting dressed, I said, no, I'm glad I did it. You know, usually my gut leads me in the right direction. Brene Brown is one of my favorite authors. And I would encourage all of you, if you've not read her books or know who she is, to take some time to get to know who she is. But in dealing with the inequities and the challenges that so many face within our communities, it's hard. It's hard work. And I probably don't have to convince any of you this morning that this work that you probably wake up every day being blessed to serve in your respective roles, it's hard work. But we didn't get into this work for it to be easy. Well, I think each of us was probably chosen for a reason. But let me say this, and the reason why I put this quote up here is if we are truly going to address the challenges at hand and make the necessary changes, and remember I said change is possible, right? Then I believe that the change that all of us want and desire, it's going to require us to be open, and it's going to require us to be honest, and it's going to require us to pull up our sleeves, right? This work, again, is not hard. I mean, it's hard, but it's doable, but it's going to require us to pull up our sleeves. But more so, it's going to require us to get in the ring. It's going to mean really interfacing with our patients and seeing and meeting them where they are at. One of the reasons why I love Brene Brown is she speaks, one of her key message is around this power of vulnerability. And I know you may be asking, what does this have to do with you and this topic at hand, as well as this work around health equity and social determinants of health? Well, the reason why I share this power of vulnerability is that the work that we do around health equity and health in general, but more so the social determinants of health, in my opinion, it requires a level of vulnerability. It definitely requires a sense of being present with the issues at hand that our patients and that our clients are experiencing. And that means pulling back those difficult layers, having those difficult conversations that sometimes we want to just like, I'm not going to approach that. I might have heard them say that, but I'm not going to go down that road with them. But that sense of vulnerability and that sense of presence is that change that we desperately need and seek. So this slide talks about the factors that determine health. And this I don't think probably is news or new news to any of you. So to have a true understanding and a complete view of the work and topic, I felt like we needed to understand a little bit about what are those factors that determine health. And there are numerous models and a lot of research around this out there nationally. So I guess probably the significant thing that when I think about this work and when I'm in the ring doing on a daily basis this work, this is real. This is numbers on a chart right now, but let me tell you, matter of factly, that these numbers are realities, right? The 40% social and economic factors, that's a reality. That's a reality that I see and experience by being in the ring every day. But what's significantly that stands out to me on a daily basis by being in the ring, not only seeing it on this chart, but that it's 10% of this work is clinical. And I know that that's hard. That's not the traditional conversations that we want to have, especially with physicians and nurses and practitioners and things like that. But again, this work is going to require us for that power of vulnerability to kind of to look at things in a more holistic view, is that most of this work is social and economic, and 10% of it is clinical. This chart again requires us to use a lens that perhaps is prescribed, and this is, go with me here, that's made more so bifocal in nature, right? The top half of the lens allows us to help or treat individuals with their physical ailments, those chronic disease that you guys probably on a daily basis are treating, the high blood pressure, the diabetes, the obesity, the cancers, all of those things. But a small portion of the bottom half of the lens, which is the close-up vision, right? That's that fine-tuned vision on the bottom half of the glass, the bifocal lens. That allows us to really see individuals and know that when they present in our hospitals or our ER or in your private practice, the health issues are way beyond just the physical, and that there are multiple underlying issues that may be occurring, such as housing, their income, family dynamics, even their employment, but even the environments that they live in. So I want to share with you a case scenario, and this is fictitious, this is not real, but I think it's significant enough to kind of show you more so the slide that we just got through referencing and talking about. So we have a single male who has chronic asthma, 3 times a week, if not more, presents at a local ER, uninsured and limited family support. These 5 bullets you guys probably see all the time. This is not anything new, right? But let's kind of dive in here and look at this case. So the staff at the local hospital continues to see this patient, probably in and out of the door of the ER, because he's uninsured. He's dealing not only probably with chronic asthma, but many other physical conditions. But the staff at the ER decides to refer them to a social worker. Let's for play, say we refer him to Bob, right? And so Bob sits down with this gentleman after multiple times coming in and out of the ER in this hospital. Bob sits down with this patient and through discussion learns that the patient has been washing his clothes, but is not drying them properly, but instead brings them home wet. So because the clothes are wet and mold has set up, therefore that has exacerbated the chronic asthma. So Bob, through many of his community connections and resources and knowing of the various resources and organizations that exist here in our great city and county, is able to locate a Chester drawer and furniture, as well as other resources to allow him the financial ability to dry his clothes, helps explain and gives these resources to the patient to allow him to be able to place his now clean and dry clothes in the Chester drawer, as well as giving instructions on the importance of drying his clothes before placing them properly in the drawers. What this scenario shows us is that because the necessary time was taken getting inside that ring again, right? Because a different approach was given towards treating the patient's chronic asthma, not just stopping at the physical, but pulling back the layers. Not only has the patient been saved in terms of his time, but also his health, even his life, but the healthcare system has been saved. But even I would say past that, our community health has been saved. So let's dive in and have a discussion about the social determinants of health. This is where I kind of start to get geeked about. This is where the real work really starts to happen, because it really interfaces with everything. It interfaces with the work you guys do, but it interfaces with everything that makes up a person. Everything from, as you can see, education to economics to the social, faith, neighborhoods, everything now is really tied to the social determinants of health. When you look at the complexities that exist within our communities around health and with individuals experiencing many times chronic health issues, they are generally health issues that affect social or stem from social determinants of health. These conditions are things that individuals are either born into, or they either develop, or they are living in, again, like I said, day in and day out, or many times there are conditions that they have to go to because of their employment. All of it has a direct correlation to the social part of a person. So this next slide, this slide here really breaks it down a little bit further into 6 distinct categories of what social determinants of really are. So there are many barriers in accessing direct medical care. I don't have to tell you, we will not spend time, because I know each of you knows that there, number one, is a problem in accessing direct medical care. And then you could probably share with me 1 to 3 things of what those challenges are. But as well as there's challenges in how our vulnerable populations go about accessing those cares, but also applying for different benefits. Some of the social economic barriers that exist within our current system include fragmented enrollment processes, stigmas. That's a word that a lot of us don't want to talk about or accept. Stigmas concerning utilization of services. Geographic location of agency matters. Many times people, I have had lots of conversations about where an organization's address is, sometimes is a precursor to when we talk about accessibility to direct medical care. Transportation and limited income all have a play in this. These barriers further magnify the issues in and around economic and health disparities within many of our communities. Let's look at one specific here, and that's being education, right? We could probably go through all of these and really look at, but let's take a moment and look at education.
I didn't understand. It's time to start.
Sorry, that's
Have a great day.
it's my Google to tell me to get started. So access to a formal education has been shown to lead to improved health. The higher the education a person has, we all know the better they have the capability to make better informed decisions around their health. That is each of us here in terms of our, just if we stopped and think about ourselves individually, it's probably the blessing of us obtaining education and higher education that has allowed us the capability of making the best decisions that we could in terms of our own health, but even those of our family members and friends. Also, education forms direct ties to employment opportunities, which we know has a significant role to economic resources. The higher the education or just education period that a person has allows them the ability to go out here and attain a job that is allows them to have a decent wage to provide income, sustainable income for themselves and their family. But more so, it's not just the income that's important, but it's when we talk about employment, we also have to look at, does that employment provide access to health insurance, right? And that's another big, I won't go down that, get on that soapbox, should I say, about health insurance, access to health insurance. Many employers still today don't have health insurance for their employees. So what does that mean? You can be employed, but still not necessarily have access to many things. So just by addressing this one disparity or just this one social determinant of health here that we're looking at around education will hugely impact the social and health inequities that we have in our communities. So I want to take a moment again to talk about another case scenario. And this case scenario is actually a real one, as the first one was more fictitious in nature. So this case scenario has to deal with the community and social context category from the previous slide that I showed you on social determinants of health. So just for reference, as I'm talking about this scenario, I want you to keep in mind, what does the community and social context category mean? This includes social integration, it includes social systems, it includes community engagement, it includes discrimination, and it includes stress. So this specific scenario is around COVID-19. And there are probably multiple scenarios that we all can talk about and speak, probably personal ones, but also ones that you guys have seen. And let me just pause here to say a huge thank you to your service. I know many of you, if not all of you, have served on the front lines during this pandemic. And I just want to stop and just say thank you. I know it has not been easy. I know you guys have probably served long hours and have been away from your friends and family. And it's the struggle has been real and hard. But I thank you for your heart, and I thank you for your dedication and service to our individuals and our patients here in Hamilton County. So a little bit about this scenario and this patient. So this particular patient was diagnosed with COVID-19 early part of this year. This patient does have underlying health conditions, specifically high blood pressure. And they presented African-American woman, insured, and has family support. They, with the chronic COVID-19, had chronic persistent coughing, shortness of breath, along with severe vomiting. Luckily, the patient did not have to be hospitalized, but her primary physician did want to order a chest X-ray at a local hospital. So the physician referred the patient to the local hospital in their outpatient setting to get a chest X-ray. So the patient presents at a local hospital, and at the local hospital with the order that was previously sent to the hospital, and the patient having the order at hand as well. Also keep in mind the patient did complete their isolation period of more than 14 days. Patient presents at the hospital, follows the protocols, the COVID protocols that were told to her, which were basically upon arrival, temperature check. Patient had no temperature. Patient did have a face mask on upon arriving, was asked to put on an additional face mask, and as everyone else was asked as well. And then was told to proceed to outpatient registration. While waiting to get checked in, people were signing in for outpatient services, signed in, and the registration staff at the local hospital, after or while getting the patient registered, abruptly ends the registration process when they see that the patient is there because of COVID-19, and leaves the patient sitting there and returns in less than 5 minutes with the hospital security. And hospital security proceeds to tell the patient that she has to leave the premises immediately and get a COVID-19 test, and that test has to be negative before she could return for her chest X-ray, which again was an order sent by her primary care physician. And that patient was escorted out of the hospital by the security guard. So I end this scenario just with these things, and for us to just kind of keep in mind is that there was no other display or signage in the hospital to say anything about COVID-19 protocols in terms of, especially for outpatient services, that the individuals, patients that are coming in to receive any outpatient services, that they had to be, have received a COVID-19 test, and that test had to be negative. No other information was given to patients upon registering for services, and nothing else was given or told to this patient other than that information. We'll come back to that scenario here in a minute. So let's talk about the prerequisites for health. What are the conditions that are the prerequisites to our health? Human beings, we all need certain things to survive, to live. And I would say all of us in here are present to this morning would say all of these things on the screen, they matter to you, and that you would 100% agree with me that you would want or need, right? And that's shelter, that's education, that's food, that's income, that's even peace. After going through COVID, I think in this pandemic, all of us would say we want some peace in our life, right? But sustainable resources and social justice and equity, all of these things are needed. That's even true for everyone here in our city and in our county. These are often, everything that's listed here, these are all referred to as social determinants of health, which again is an important point for us to move forward, in that if they're socially determined, then we can change them. And that's the good news that I shared with you earlier. Change is possible. So I wanted to share, I could not have this opportunity to be in front of you and not share a little bit about the organization that I, again, am honored to serve as the executive director of. And I share it not to toot our horn, because that's not what this is about, but I just share it to just show you an example. And there are many examples in our cities of this, of systems or organizations like this. But I share it more so from a lens of why community health. You know, it goes back to our lens perspective, right? We have to address inequities not only at a system level, but I also feel at a community level. So an example of the community level is a purpose point community health that exists in our community. So health starts not in hospitals, or not when patients present in front of you with, you know, hey doc, I'm sick, I don't feel well. But that health, their health starts way before then. And it starts in their homes, and it starts in their schools and their neighborhoods and their communities. And health is greatly determined by access. Access is another word that matters to the social and economic opportunities that they have for themselves. So when we look at this, I want us to think about two things. And I'll share a little bit quickly about purpose point community health. I want to ask two questions as I talk about purpose point community health. What if a person gets sick and they need to see you to treat their illness, but they don't have adequate transportation? And you probably have seen individuals like this before. What if you have to prescribe bed rest to one of your patients, but that patient that you're treating is experiencing homelessness, and you're not aware of this, and they do not have access to a safe bed? So I share these two questions with you because, again, health starts not in our hospitals and not in our doctor's offices, but health starts in our homes, in our schools, in our communities. So the reason why we wanted to open an agency or organization like Purpose Point Community Health was to be in the heart of communities, to work with all of you, to be honest, that are present here this morning, to work with you to be able to join and lock arms to say, we're here in the community. So when you see a patient that, based off those two questions that I just asked you to think about, that needs transportation, there is a community-based organization that is really integrating two things within their practice. And that's one, being patient-centered, where the patient at Purpose Point Community Health plays an integral part to how we provide health services. And that at every integration, when our patients come through our doors, at every point, it's an opportunity for us to identify not only from that medical perspective, but also from that social and care coordination perspective. So yes, our providers may be looking and treating their physical ailments, but we're going to be looking to see, okay, well, if you are having problems accessing transportation or you need help accessing transportation, how do we get you that? How do we help you with that? Or if you are experiencing homelessness and bed rest is important or you need that, not only for your physical, but also for the mental part of it, right? Then how do we help you with that? As individuals and patients continue to face challenges in accessing care and the gaps and the fragmentation that exists in services within both the medical and social, it's important that we offer those supportive services necessary for them to have that improvement in their health and well-being. The other thing that's very important when we talk about community health and that we do at Purpose Point Community Health is the community-based care coordination. And community-based care coordination is, I think, is something that we're seeing nationally really starting to not only be talked about, but even starting to be more so created. And the best way that I can say or talk about community-based care coordination, any social workers that are here this morning, is social work. It is social work at the best, at the core. But it is like in the ring, every day, boots on the ground. You have lay leaders, you have licensed clinical social workers, BSWs. You have a mix of individuals that are integrating their skill sets, their knowledge, but also their hands and their feet to be able to be in the communities, really engage with patients and with individuals, not only to help them navigate the complexities of our healthcare and social system services that we have here, but help them listen, number one, allow us to listen to their needs, but also to individually target what those needs are and connect them to the right services at the right time. I tell people we don't have a problem with services in Chattanooga and Hamilton County. We have over 1,600 nonprofits. That's amazing. A lot of cities don't have that. And if you just go up and down, north, west, south, whichever way you want to go, here in Southeast Tennessee, there's a lot of our counties. I've been blessed in my 20 years to be able to work here in Hamilton County, but also in our rural counties. There's a lot of our surrounding counties that don't have not even less than five organizations that they have to pull from. That matters. But we have over 1,600 here in Hamilton County in the city of Chattanooga. That's phenomenal. So we don't have a problem with resources, but we do have challenges daily in terms of how people access those services. And something else that I always talk about is that when you talk about accessibility, people think that just because those resources exist within our city and with our county, that, oh, well, great. If they exist, then people can get to them. Wrong, incorrect. Just because you put the door in front of me doesn't make it accessible. Doesn't make it accessible. Number one, I may not see the door. Number two, I may not have the hands to touch the knob to get through the door. Number three, I may not have the legs or the feet to get me through the door. So then that's where we as providers, clinicians, practitioners, social workers, lay leaders, elected officials, I don't care who you are, that's when we get in the ring with our patients and our clients to help them get through that door. That's when it becomes accessible. So the community-based care coordination that we have implemented at Purpose Point Community Health, why it's so important is, for one, we see based on data is that it helps to reduce readmission rates to our hospitals. Again, I don't have to share with you what hospital admission rates look like, and even the ER admission rates are high, right? But more so, the community care-based coordination improves the decision-making about where to go for care. When you're sick, you're sick. And a lot of times with our patients, they always talk about how it's difficult understanding all of the complexities and all the rules, that this agency has this rule and then this agency has this rule, and I just don't understand it. And so when that frustration sets in, along with the mistrust that a lot of individuals have with systems, they say, I'm not going. They take their hands from it. They remove themselves. That's why you probably ask yourself, well, why haven't I seen you, back for your follow-up appointment? Because they're frustrated. They have that mistrust. So community-based care coordination is so key. And it's about partnering with patients to help them, again, to navigate these complexities that exist within our healthcare and social service system. So this, I hope everyone this morning knows about the picture of health, has seen it, has touched it. You have slept with this report, this book at some point in your life, right? If not, please do so. Because it's important that we really understand, if we're in this work together, is that we really not only see it from the perspective of everyday treating our patients and clients, but that we see it from the data and the statistic lens in a sense. The health inequities in our communities, they're very much real, and not only real, but they're persistent, and especially by race. And again, at the beginning, I talked about, we don't sometimes want to talk about stuff, but this work, that power of vulnerability, this work requires us to talk about issues that sometimes none of us want to talk about, and race is one. And sometimes, lately in our community and in our counties, we've had a lot of racial injustices. But these are conversations that we have to have, and more so in our healthcare systems, to be honest, because they do exist. And if we're going to make any small to large improvements and changes, it requires us to have this level of honesty and reality to it. So we have a lot of disparities in that shows within our data. But I show this screen just to show and to sum it up that the data doesn't lie. I don't even have to give any more context to this screen, because you see it here, black and white. It is evident that, and this is our numbers. These are our realities. So I didn't even have to go, to a neighboring county. I didn't have to go across state line. I just pulled it right here from Hamilton County. These are individuals that most likely you have treated and that you have touched at some point in your professional career. That Black folks in Chattanooga, Tennessee are 4 times likely to die because of hypertension. That has to change. 2.5 times when it comes to diabetes. These are our realities, and it's important that we continue to look at them, acknowledge them, but more so start to address them. So this is, out of all the slides that I probably show you, this is probably one of my favorites. And one of my favorites because I always get asked, well, why does it matter? Why do you go hard? Why do you stay up endless nights and cry and toil? And why are you out here on the front lines doing COVID? And why are you, working in a nonprofit that don't pay you much? And why did you, become an elected official? All of those whys. Why it matters is because of this one quote that I stumbled across and I love so much. Health is truly a community effort. People have the power to change their communities. We have the power to change the health of our patients and those in our communities. We need to recognize when and where certain communities are being excluded from decision-making processes and ensure that all people have the opportunity and the capacity to participate when it comes to their health and healthy communities. And by doing that, it's remembering patients are treated in hospitals, but they heal in their communities. You may see them in the ERs here. You may see them in your individual practices, but guess what? They don't stay there with you, right? They're not living with you 24 hours. You don't take them home. They're going back to live underneath that bridge. They're going back to live in a zip code that has humongous violence, huge numbers of violence. They're going back to a community that has no sidewalks. They're going back to a home that has no drywall on it. And these things that I'm speaking of are truths. I've seen them for myself. So this slide I love because it's yellow, and yellow is my heart color. So wanted to bring some sunshine after kind of talking about some of these disparities and inequities that we continue to see. But these are just basic human needs that we need. The key points made here, and that I want to reinforce, is that we all need education. Education helps us to attain that decent employment in jobs that I've mentioned before. We need the means to get from place A to place B, right? To get to work, to be with our friends and families. All of that matters. We need the opportunity to participate in decision-making processes so that we can create, again, healthy communities. But that means all of us, even our patients, have a right to be a part of that decision-making. We need to feel safe and connected. That's one of my favorites. Me as a patient, I should be able to feel safe and connected, regardless of the color of my skin, regardless of the zip code that I reside in. We need to feel free from environmental hazards in our neighborhoods, our work environments, and even in the schools. We need to have access to services, get this, services that meet our needs when the need arises. That's that patient-centered care that I was speaking of. Not when we as elected officials, not when we as leaders, not when we as CEOs think that patients or clients or our constituents need it, but when the services, when the need is there and when the need arises, meeting people where they are at. All these factors establish the conditions that everyone has the right and the need to be healthy. Ask yourself this: can a person truly be healthy without access to certain resources, such as affordable homes, such as safe communities, such as a good education and a good job? So now that I talked a little bit about the problem and the challenge, and we've had a bit of an understanding or discussion about advancing and improving health equity and an understanding of a little bit about social determinants of health, what can we do about it? How do we make that change? The work of addressing health equity is not easy, again, but it is achievable. It requires many things, but the three that I want to leave you with are key to what, again, sustains me and keeps me going in this work every day. And that's these three. But I would encourage you to find what works for you. What is your why and what you're doing every day in respects to health and the health of our community. So the first is being intentional. This requires a shift in thinking. Oh my gosh, our mind is a powerful beast. It requires us to have a different thought set. How we approach people, how we look at people, how we treat people, even in terms of providing treatment and health, and understanding of health and addressing the social, going beyond and past the physical aspect. And it seems simple, but I have to even say it. It's about valuing everyone and making those intentional efforts. Sometimes too often I see, and I have to even do it myself, is I have to stop and say and be intentional with this work. Every day when I go into Purpose Point, I come with my own baggage, right? But I have to remember that the people that are coming through those doors, they're carrying a lot more greater challenges than those that I'm carrying. So I have to be intentional in the efforts that I make in engaging with our patients and our clients that come through Purpose Point. Second, it's our approach, but more so, do we have a plan of action? Do you have a plan of action? What is your approach? In order for this work to be successful, it requires us to have a plan, an approach that's multidisciplinary, Multidisciplinary. It requires us to have multiple levels of response. If you have done something the same way all the time, stop doing it. It's just not going to get you there no more. It is time that we require a different approach to treating and advancing and improving health equity by going beyond just the physical, by getting in the ring and really pulling back those layers when it comes to our patients and those that we're treating. And the last one is probably one of my favorites because I'm a people's person and I love people and connecting with people. It's partnerships. To achieve health equity, it means we, each one of us, starting with myself, we have to check the I syndrome and mindset at the door. Check it at the door. You can't do it. I can't do it by myself. We're not talking about any other state, any other county in Tennessee. We're just talking about Hamilton County and the city of Chattanooga right here, our home, our city where we pay taxes, that we raise our family, that we live in, that we work in. If we're going to change the disparities and the health outcomes in this city and in this county, it's not about myself, it's not about you, it's a collective, it's all of us. But that means we have to stop working on our silos, and it's about, again, recognizing the differences that exist, and differences are not bad, right? And it's also having those difficult conversations that sometimes we often want to shame from and ignore. All stakeholders, those from government, elected officials, faith leaders, churches, nonprofits, public, private sectors, healthcare providers, and get this, even patients themselves, all of us have to be engaged and come, not only engaged, being engaged is one thing. We can be engaged because I'm engaged, you're engaged, other people that I just talked about are engaged, but are we coming together to create the communities that enables each and every one of us, all of us, to attain and sustain good health? So why all of these three things? Being intentional, having what is our approach and having a plan of action, and partnerships. Why all of those, in my opinion, are essential in this work is because being intentional in our efforts to advance equity in our healthcare systems requires us to have a different approach and a plan of action that works to change the narrative. So those that we see and see within the communities that we serve understand that health is created in the community, right? Patients are treated in hospitals, but they heal in communities. That health is created in the community by people working together to create social and economic conditions, which ultimately result in the improvement of health. The partnership of building understanding around the social determinants of health and how it affects and correlates with health, that is essential. And that is what we've talked about and what we'll continue to work on together. So I close going back to that last case scenario that we referenced. That patient was me. So I end saying that titles don't matter, zip codes and race shouldn't matter, but at that present time, when I went to the local hospital here, at that present time, what should have mattered was my complete health and well-being, my physical, my social, and my mental well-being. Thank you. So at this time, I'm gonna stop sharing my screen and I think we can open it up for any questions. I hope individuals have some great questions for me.
Ms. Jeter, that was fantastic. What a great presentation. I had a question actually to get things started. So you serve as a county commissioner,
Yes.
and what do you see from the county commissioner standpoint of things that can be done through the county to help address the healthcare disparities that we face?
Great question. So, and one that I actually am glad you asked, and one that I would like more people to ask, not only of myself, but of my other colleagues, as well as to the mayor, is one of the things. So as a county commissioner, our biggest responsibility is the governing board for Hamilton County is our fiduciary role for the county, right? We oversee the budget for Hamilton County. And the two biggest items that we budget here in the county is our law enforcement, our criminal justice, the jails, which is currently Silverdale, and our Hamilton County school system, the Hamilton County Department of Ed. So those being the two biggest ones, but we also have a huge leadership role and play when it comes to health in our county, because the current health department is under the Hamilton County government. So to your question, I feel that one way that we as Hamilton County government and as commissioners, as leaders in this city and county, is we, number one, have to, and let me reference it by this pandemic, because let's reference it by the current realities that we're living in, right? We have to be the leaders of any public health issue because we run the public health system. So we have to be engaged. We have to be able to disseminate the correct information when it comes to a pandemic like COVID or any other health disparities across the gamut, diabetes, cancer, you name it. Yes, we provide services, direct services to individuals in our county, but it goes beyond that. It really is about disseminating the information and a more leadership engagement, in my opinion. And one of the things that I hope that we can start kind of shifting, and why I put that partnerships and I got so geeked about it, is we've got to start leveraging, in my opinion, because we do operate the public health system here, is we've got to start leveraging all of our partners, both from a very grassroots aspect, but even all the way up to a governmental aspect. So for instance, we have a new administration at the city level, right? We have a new city mayor. And I think everyone knows by now that Mayor Kelly has announced a new health kind of aspect to his under his leadership. This is a distinct opportunity for the city of Chattanooga to do this. It is not a bad thing. Let me say that. It is not a bad thing. It is enough work here in this city, in this county, when it comes to health challenges and health needs. So this is an opportunity for us on the county side with our health department, and what our role is to really engage and be at the table and help lead with now the city of Chattanooga to work within our communities, respectfully the city, as well as throughout the county on what health and start eliminating some of these disparities from a more leadership and education aspect.
Thank you.
You're welcome.
One of the questions on the chat was, what is the best way for us to get involved in some of the work that is going on in the city and the county?
Oh, wow. So one great question, and thank you so much for asking that, is I always tell people is one, and this is one of the reasons why I ran to be a county commissioner, is that I wanted people to feel connected to the person that was serving in their respective seats. So for me, I wanted people in District 5 to feel that they knew who their elected representative was, and for them to feel like they had a sense of connection. I think that is where it starts. Relationships matter. Relationships are key. If you don't know, if I didn't know Bob, and if I needed something, or if I didn't know Shawani and I needed something at UTC, all of those things, or even Dr. Haynes, I'm naming all the people that that are friends and that I know. if those relationships didn't exist, then I would have a sense of complexity and struggle in the work that I do. But because I do have those relationships now, and they have relationships with me, it requires and allows us to more freely be able to make connections when necessary, when needs arise. So I always tell people is to know who is in your circle. Have a circle, have a base, right? And that base may continue to change over time, and it certainly should grow over time, but have a circle and have a base. I have key folks within my social and healthcare context, my go-to people that when I need something, I connect with them. And if people want their person to be in their circle to be me, I'm raising my hand. But get to know who your elected leaders are, engage with them both on the county side and the city side. It's important that we should, if we're not consistently in your circle, then we should be very much close to your circle, let me say it that way, because we do play a role. I mean, we certainly can't, change the system overnight, but we should be at the table with you and engage with you in this work. So when you do have questions or you do have needs arise in your respective field or area of work, then we can help you with that and be a part of that.
And I'm sure there are ways that people can be involved in their own department, in their own clinics, to really help with that. And also just individually to, as you said, look through that lens at your own behavior and look at the patient you're seeing, so that you can really be present when they're seeing you for a health problem.
Yeah, and I think sometimes it's going beyond, like I would say if there's an area that you don't necessarily don't know about. So let's just say, for instance, you may be seeing a patient that has presented multiple times in front of you, and you have some sense of some challenges or underlying issues there, but yet you have not yet addressed that. Again, it's that getting in that ring. I cannot stop emphasizing that because it's important. This may be an opportunity where you might, for instance, start going into some of the communities that your patients may reside in. I always get told that if you can't be it unless you see it. And a lot of that is you have to even go into some of these communities to see the realities that your patients are living in. I think sometimes seeing it may allow you as clinicians and practitioners and providers to see it and treat it maybe in a different way. It even may mean, engaging with another colleague that you know of within the hospital system or in other respective areas here in health, is to have an open dialogue to say, hey, I have patient Z that is experiencing this, but I think there's some underlying issues. What are some other, connections that you may know of? I think, but I think too often we again tend to just want to treat the overlying, which is that physical, and we don't want to get underneath. We don't really want to go to those difficult conversations and look at those other underlying issues.
Yeah, I know Bob Zelstra and I have talked that many times, as you said earlier, people won't even ask the questions about social determinants of health because they say, well, I have no social worker. How am I going to address these problems? And so they don't even ask. They just avoid the questions. So I want to thank you for this great talk. There are a couple other questions we can get to very quickly. One from Dan Stanley says, to what degree does fatherlessness correlate as a social determinant to healthcare disparity?
That's a great question. So I think, our family support system is huge when it comes to our health outcomes and what it means on a daily basis in terms of how we deal with health issues or how we are healthy as individuals. So many times, one of the things, and I'll speak from what I see and what I work with within communities, individuals that have no or very limited family support. They come from very broken household systems, whether that be, you know, no father in the home, no mother in the home, or they're being raised by grandparents. There's a lot of people that I come across that are raising themselves. There are kids out here that are raising themselves or have raised themselves. Keep in mind that individuals are a product of something, right? We are each a product of something. Luckily, all of us hopefully are blessed enough to say that we are what you are seeing, what I'm manifesting is the product of a single mom, yes, but a single mom that was given opportunities of employment and opportunities of health insurance and opportunities to allow me to have an education and things like that. So because of those opportunities, I was able to have better outcomes when it comes to my health. But many times, a lot of the people that I see that don't have that, they're the product of their environment and they're a product of the lack of. So that fatherlessness and the lack of or limited family support system is very much a social determinant of health, and it definitely affects a person's health. But again, there is help and change is possible even around that one issue. And that's where that partnership, that's where that community engagement, that's where being able to engage people and seeing that need is connecting them to other resources can really help to change that and fix that.
Great, thank you. One of the other questions was, is the county website up to date regarding resources to help address these challenges?
Thank you, Pamela, for asking that question. And I'm guilty enough. I won't say I go on the county website just enough to be dangerous with it. I don't know if it has the resources that each of us, and this is just being transparent and real with you. I don't think it has the resources that you and I or all of us would want to address the challenges that we're facing, right? But that I think the health department's website would be a great resource that I would direct people to more so than the county website. Not to say the county website is not one you shouldn't reference, because again, going back to engaging your elected officials, getting to know them when we meet, those types of things certainly help and play a role, but it does not necessarily have all of the resources that I think to address some of the issues and challenges that we're facing. No, it doesn't. Oh, okay, I see. You mentioned the county health department website. So the health department website is a great start. Are there areas of improvement needed? Certainly, yes. Yeah. We definitely need to improve there, but that's where I was referencing. Now there's an opportunity of working with the city and their new office. But this is also where, let me give you a call to action to each of you. This is where you guys are the boots on the ground. I know some of you, but I don't know all of you. I hope to meet all of you one day. But this is where in your respective areas of healthcare systems, whether you're in a hospital or your individual practice, where you can engage individuals like myself serving as a county commissioner, or even if you have direct relationship or contact with the administration there at the health department, is talk about, what you're seeing on our website, what resources are missing. I know many of you like Christy and Angel Moore with Erlanger Southside, Ray Bond, I see is here with us. Many of them are already engaged at that. And so they speak to those truths and are able to share input in terms of what resources are needed and how do we disseminate those resources. But I encourage all of you, if you're not engaged at that level, to be engaged, because we certainly definitely have to know where we have our shortfalls and where we can make those necessary improvements.
Katelyn, the only other comment was from Christy Wick, your nurse practitioner, and she said, physicians are needed in multiple capacities in community work, even basic oversight of other providers.
Yeah.
So
thank you, Christy. I agree.
With that, it's about 16 after the hour, and I think we will end the presentation. I don't see any more questions. The only other comment that I wanted to make, Ms. Jeter, is that a definition of being in the right position and serving your calling is where your passion intersects with the community need.
Mm.
And you certainly have done that. And
Thank
thank
you.
you so much for this talk today. It was a great talk, covered a lot of area, and I think it will be part of our journey as we understand the social determinants of health and address some of the disparities we see in healthcare. So thank
Awesome.
you again so much. And I look forward to talking with you further.
Yes, thank you so much. And don't be a stranger. Come see me at Purpose Point or call upon me if you need me. Thank you, guys.
Thank you.
Thank you,
Have a
Katelyn.
great day, everybody.